Hi, this is Dr. Naidu. I'm going to rediscuss the tuberous breast deformity and each type of deformity because I've received a lot of questions about correction. So if you recall, the type 1 Grolleau deformity is that in which the medial inner aspect, kind of this inner quadrant of the breast, the lower part of the breast, has not fully developed. And the areola may be large and the rest of the breast tissue has developed. So the question is, how do you correct this? So remember, we want to correct the part that's deficient. And also we want to reduce the size of that areolar complex. So just to draw it out for you, there are a couple ways to do this. One way is to reduce the nipple areolar complex, which we like to do in each case, and that also gives us good access to the breast. And in the case of a large amount of breast tissue, we're going to do a breast lift, and typically we'll do that through the vertical breast incision. We'll usually put in an implant in this region, so you'll have an implant in here to give the breast some shape. In most cases, patients aren't really looking for volume, they're looking more for shape. So we're putting an implant in here to give the breast its shape, and then we close up the tissue. So that's one way to do it. Another way to do it is if a patient doesn't have a lot of lower breast tissue, that is, if they don't have much that needs to be lifted, and they just need volume to shape out the breast, then we can just use this limited incision around the areola. We go down, we release all this tissue at the bottom, and it's really in this area with type 1 Grolleau. We're releasing all this tissue which hasn't developed, and then we're putting in an implant to fill out that space. And again, in most patients, it's not so much to add volume as to really provide that shape, that nice round shape that we need to the bottom of the breast. Typically, these are done under general anesthesia. They're done in the hospital. It's an outpatient procedure. Typically will take 1.5 to 2 hours to do the procedure. If we're doing a lift, then in general we want to set aside a good 1.5 to 2 hours of the procedure. If we're just releasing the tissue in this quadrant and putting in an implant, then it'll take us about 1.5 hours. So it's an outpatient procedure and the patient will go home the same day. And in general, patients should limit their activity, any strenuous activity, for about 2 weeks afterwards, although most people can go back to work within 3 to 5 days if their work is not strenuous. So I hope that's helpful. For more information, please visit my website at www.naiduplasticsurgery.com. Thanks for watching.